This patient was referred to me for a possible dislocated IOL. And you can see that there is excessive capsular phimosis, and you can see that the capsular rhexis is small, has contracted, and is displaced superiorly. And so the referring physician thought that perhaps the IOL capsular bag complex was also dislocating superiorly. When I inspected this patient, it was clear that there was excessive anterior capsular phimosis, and I discussed with the patient of two options. Option number one is doing a YAG anterior capsulotomy with the understanding that higher energy will be used and that it may be done on more than one setting, versus alternatively to book the patient for surgery and to do capsular reconstruction, where you can use micro scissors like horizontal scissors from MST, where you basically can cut through and basically widen the anterior capsule. The benefit of the surgical aspect is you're not using any energy, and the incidence of pitting or hitting the lens is obviously much lower when you're dissecting this mechanically. Obviously, there are risks with surgery. Anytime you go into the eye, there's always risks of infection. But ultimately, the patient opted to go ahead with a YAG anterior capsulotomy, and this required a great deal of energy. I don't think this picture gives you much justice on how dense the phimosis was, and so I went ahead and had to do this procedure twice. And so here you can see the ultimate result. This is just strictly with laser, no surgical intervention, and you can see that now that I've opened up the capsular rhexis rim here, you can see that the actual IOL is centered in the bag and there was no dislocation. And so the point that I wanted to highlight to you is you can't always use the capsular rhexis as a sign of dislocation. Sometimes the capsular rhexis can look slightly shifted to the right or the left. That could be due to phimosis. It could also be that the primary surgeon may have placed the capsular rhexis in a decentered configuration. But ultimately, once you remove the phimosis, you can clearly see that the IOL capsular bag complex in itself is stable. So I hope you found this case to be useful, and thanks for watching.